Hello, my name is Trairatvorakul. I'm a developmental pediatrician at King Chulalongkorn Memorial Hospital in Bangkok, Thailand. I'll be presenting the findings from my fellowship project when I was at Cincinnati Children's Hospital on behalf of our team. As more children with congenital heart disease, CHD, survive into adulthood, there is a shift in care to minimize long-term morbidity and optimize neurodevelopmental outcomes and quality of life. Children with CHD are at increased risk for attention deficit hyperactivity disorder, ADHD, which leads to the objective of our study to determine if children with CHD and ADHD clinically treated with stimulant medication were at increased risk for changes in cardiovascular parameters or death compared to CHD matched controls. In addition, among those who were treated with stimulant medication, to determine if stimulants were effective in alleviating ADHD symptoms. Retrospective cohort study with up to 1-to-3 matching was performed based on the highest complexity CHD diagnosis and the visit age. Outcome measures including heart rate, blood pressure, corrected QT interval from electrocardiograms were extracted from electronic health record over 12 months. We use mixed effects models for statistical analysis. Our participants included 151 children, 46 from exposed group, and 105 from non-exposed group. Average age at first encounter was about 8 years old, just over half were male, about 80% were white. We were able to match over half of the severe and palliated single ventricle cases. You can see here the examples of cardiac diagnoses that we match from in the right column, including tetralogy of Fallot with pulmonary atresia, cardiomyopathies, hypoplastic left heart syndromes, and tricuspid atresia as an example. For AIM-1, no statistical significant differences in heart rate, systolic blood pressure, corrected QT interval or death rate between exposed and non-exposed group were observed over time. There was a statistically but not clinically significant difference in diastolic blood pressure between the exposed and non-exposed groups over time. Diastolic blood pressure did not significantly change over time. Figure A shows the estimated mean heart rate, while figure B shows estimated mean systolic and diastolic blood pressure. Children in the exposed group had a significant improvement in ADHD symptoms after starting stimulant medication. Figure A shows the parents and figure B shows teachers' ADHD symptom scores rating scale. X-axis shows the symptom domains, while Y-axis represents the symptom scores. Different colored bars represent the scores at different time points. At 6 to 12 months, there was a significant decrease in ADHD symptom scores compared to baseline. In conclusion, we found that stimulants should be considered as an effective first-line pharmacologic therapy for the management of ADHD in children with congenital heart disease when prescribed with appropriate monitoring and care coordination between pediatricians and cardiologists. Thank you.